Raksha Summit 2024, powered by Medi Assist and BCG.
Distinguished guests, industry leaders, and friends, I am Nikhil Chopra, the Chief Business Officer at Medi Assist and your host for the evening. It is my great pleasure and honor to welcome you to the very first edition of the Raksha Summit. Today marks the beginning of what we hope will become a defining event in our industry, bringing together visionaries, experts, and change makers from across insurance companies, employers, intermediaries, and healthcare providers to shape the future of our businesses and communities. The Raksha Summit has been designed with one purpose in mind: to create a platform where ideas meet action and where industry leaders can come together to collaborate, innovate, and drive the next phase of growth and transformation in the insurance and corporate worlds. I'd like to now invite the chair of the summit, a pioneer in the industry, Dr. Vikram Chatwal, to officially open our event and share his thoughts. Please join me in giving a warm round of applause to Dr. Vikram Chatwal.
A very warm welcome to the inaugural Raksha Summit 2024, where we gather under the transformative vision of Borderless Health, a cornerstone to Viksit Bharat and insurance for all by 2047. In our interconnected world, health challenges recognize no borders, whether it be disease outbreaks, healthcare innovation, or the fundamental right to accessible healthcare. The solutions too must transcend all boundaries. Today, we stand at a critical juncture where technology, collaboration, and shared knowledge hold the power to create a healthier, more sustainable world for all. As we discuss borderless health, it is more than a theme. It is an imperative. It is the emphasis of a need to reorganize and energize India's healthcare system, dismantling barriers of access, and ensure healthcare reaches every citizen regardless of their location or circumstances. As we gather here, we're not just sharing ideas. I believe we are architecting the future. The Raksha Summit 2024 theme resonates well with India's ethos. It is a world marked by interconnectedness, and health cannot remain confined to any region or one portion of our nation. Today, we share not only our successes, but also challenges as we engage in a meaningful conversation that help transcend borders in healthcare and in health insurance. Thank you once again on behalf of each one of us here to have joined us at this inaugural Raksha Summit. I now take the opportunity, the much-awaited keynote address by Dr. Somanth, Chairman ISRO. Dr. Somanth is and has been a rocket scientist in his life, and taking office in January 2022, he has delivered on India's aspirations in space technology and what we're doing back here at home. With that, I'd like to welcome Dr. Somanth on the dais for his keynote address.
I'm really honored that you are bringing together all those who matters in this domain of healthcare delivery and really deliver it as a borderless healthcare for the entire country. The theme possibly is reflecting what the borderless healthcare and the borderless space means. The space is also borderless. Of course, all of us know that the healthcare delivery is one of the important domains that we need to address in the coming years for this nation. And in this domain, I think many things are at stake for us at this moment. One of it is the diagnostics. For example, for most of the people in villages and rural area, access to medical diagnosis is going to be one of the important issues. And some of the research that is happening in institutions like Indian Institute of Science, where I have a I have been seeing people working on miniaturized diagnostic equipments and tools by testing your blood on various samples and then looking at how the many such diseases can be diagnosed faster than what you go to a hospital and do a very costly diagnostics processes. And this becomes important research domain for a country like us. For example, some of the infectious disease testing. When some of the pandemic nature rises in some sector of the country, we need to test large numbers, lakhs of them, to isolate them and take care of them. So this becomes a very important tool at the hands of local healthcare professionals and providers. Another area which the healthcare providers will face in the coming days is creation of better hospitals with equipments and the healthcare mechanisms. Though I thought that medical care is more of dealing with human beings, but then I understood that it is more with equipments and engineering jobs. I myself being an engineer, when I went to a hospital, I saw they are all full of robots, computers and screens and 3D machines and graphics and things like that, more than that actually you see in a hospital. Possibly the doctors have become half engineers. But then there is an issue with the equipments that we are using in our hospitals. We see most of them are not built in India. And many of them actually has technologies which are amenable to be designed and developed in this country. And this is something which I have been telling and talking to people. The third area in the medical domain is about the medicines. I think the research on generic medicines as well as vaccines. I think this domain is requiring great attention. Recently, we have tied up with the Department of Biotechnology and Space. We had an MOU recently. And we wanted to work with them in helping the biotechnology research to come into space. And you will wonder what space has to do with this research domain. I think all of you know that we are into human space flight. And taking human beings to space is one of the biggest challenge, I think all of you know, because once you are in ground, that we have an advantage of gravity. We are able to stand erect. Our fluids flow in a manner that is designed in a manner that there is a gravity differential which helps us to have a certain way of the fluid flow in this. But once you go to space, the zero-gravity environment or the microgravity environment changes everything. Maybe all of you know that the space research has been really a contributor to healthcare in the past, directly or indirectly. And many of the diagnostics tools and equipments that you talk about today came from the original research that has happened in space. And so there are many such connections between space and healthcare in the many years before. We also work with space healthcare providers in the past. I think one of the work that the space people have been doing is related to data. The data collection and analysis is going to be a very important domain in the coming days. For example, the genomics data is one of the data that is very important for us. Equally important is the health data which are collected in hospitals and how we can bring all this data as a common data pool on which that you can apply tools like AI for making better judgments of our nature of healthcare requirements and interventions which are required in this country, region-wise, culture-wise, etc. I think if that really can be done, we will be able to do great work. We need to have digital connectivity. In the domain of technology, we talk about IoT, large models and AI. I think these are the buzzwords that all of us use today. Can we really apply those technologies in the healthcare domain in a bigger manner? Growth in technology in these domains are going to be very, very important, especially what you mentioned about the digital connectivity, AI, large data collection methods. And I'm very happy that today in space technology, we have made an example on how complex technological problems can be handled in this country and solved to create a vibrant space ecosystem in this country. And we are going to take it to a much greater scale with the vision of the government. Thank you so much for this opportunity to come and speak about what connect that we have between space and healthcare domain and how technology that we have harnessed in this domain can really be replicated in domains like healthcare, especially in the area of diagnostics, medical research, equipment and systems manufacturing, and also digital connectivity. With this, let me thank you and wish all the very best for this Thought Leaders Summit I believe the Raksha Summit reflects really about a protectional environment that you are going to make. The word Raksha itself is meaning is protection or of all of us. I believe the healthcare is nothing but a protection, as we provide like a space system that we make in for this country is also for a protection of the nation today. I believe that this summit, this being the very first one, you will generate certain thought, ideas to take it forward into business models. I believe when you come back to the next conference, possibly, you will also have some examples of outcome that has come out of this thought process. I believe that will happen, and thank you so much for this opportunity to speak to each one of you.
Many congratulations to Medi Assist team, Dr. Vikram. I think along with BCG, they've done a fabulous job. Every single idea that comes in has to start at a conceptual level. Borderless Health is one of it. In my own belief, in my own understanding, it's not a mission or it's not a vision statement. I think it's a call for action. There's a lot of things that are going together for us as a country. But health space, we have some obvious gaps. And to bridge that gap, we'll need initiatives like Raksha Summit, as well as Borderless Health, which has been talked about.
I think our vision remains the same, that as India celebrates its centenary of independence by 2047, and we expect every individual to have some kind of a health cover, right? And this is not going to happen just because of any one segment. We're going to have a combination of how employers, provide cover to employees, how government actually provides cover to citizens who can't afford it, and how we enable individuals who can afford it to be able to procure the kind of cover, that they can manage. So we're going to have to fire on all cylinders, right, on all three segments to be able to get to that vision of getting 100% cover. For us, I think it was important as a leader of the market to ignite conversations, to go beyond just benefits administration, and then really solve the problem of how everybody in India actually gets access to healthcare in a meaningful and a sustainable, manner. And I think we are very happy that we've had the first set of those conversations, and we hope to continue to do this, every year for years to come.
Raksha Summit 2024, powered by Medi Assist and BCG. Raksha Summit 2024, powered by Medi Assist and BCG.
We now come to one of the most anticipated segments of today's event, a dynamic panel discussion on a topic that is increasingly relevant in today's globalized, digital-first world. The topic is health benefits, navigating the future of work, and embracing a borderless world. Please join me in welcoming the moderator of this panel discussion, Mr. Alpesh Shah, Senior Partner and MD, India Boston Consulting Group.
Borderless health, we see it not as a theme, but more a movement or a paradigm, which should help us deliver India's healthcare aspiration of 100% coverage, 100% cashless, a fully interoperable health data stack, etc. The only way this is going to happen is if we learn both from India's experiences, but also global benchmarks. And so that's the theme I actually wanted to get all of us started. So Vibha, from your perspective, if you were to think of this agenda of borderless health for India, what would your thoughts be? How should India think about it?
It's very topical because clearly a major health event sets a family back by one generation and takes a long time for them to come out of it. So clearly there are three tenets to this. The first one is awareness, accessibility, and affordability. And I think India Inc. needs to work on all three. A lot is being done, but I think unless we solve some of the significant roadblocks, I don't think we are going to make a material impact in terms of insurance for all by 2047, 100 years post our independence. So on the first one, in terms of awareness levels, what our regulator has done, I think it's a good idea, wherein allocating states to each one of us to collectively underwrite risk in a simple over-the-counter product on a digital platform. I think that will make a significant inroad. I'm hopeful that the pooled risk concept, because none of us can A, reach them individually as companies, and B, also underwrite the risk. So I'm hoping that the awareness part of it, because all of us will be working in our respective allocated states, that should go up. The government is also doing things like PMJ and so on. Second is in terms of accessibility, more and more touch points, physical, digital, a combination of all of them that is required. And all of us are, again, it is an imperative that we are out there. And then the affordability, again, close correlation to per capita GDP. That is important. And today we are at some 2600 odd USD. As that climbs up slowly but steadily, it's bound to come through. And final aspect is data. In the absence of data, there's very little we can do. There'll always be a tussle between us and the final policy holder. So data is the oil. How the government mandates it, the way NHS does, I think that also holds a key to more and more insurance penetration.
So if I go right, Harvey, if you actually look at it from a, your global experience, what pointers do you have for us?
I think the opportunity and the potential in India is a no-brainer. You are in a unique position, as I said, rapid growth, digital revolution. And to me, the real challenge is how you achieve this without widening, I would say, expanding the inequality gaps that already exist. How you avoid doing the same mistakes than the rest of the world. Take the US as an example. 24 million people without coverage. And when I say that, 75% of them, they are full-time workers. 3 in 5 people are anxious about needing medical treatment, and mostly because of the financial for them and for their families as well. Even Europe, even where I think everywhere someone is waiting for essential care. That's the case in the UK sometimes. And even France, where more than 50% of our doctors are over the age of 55. So the one big question for India is the question of universal health, the question of, I call health for all. And I mean, health needs to be designed, provided, and delivered in a way that inclusivity and affordability are at the center. And that should be relevant, of course, for different demographics and culture. Such a big country. So I don't have the secret recipe, but if we don't want anyone to being left behind, I think that a real partnership, a real collaboration between public, private sector will be key. And most of the national problems require national solutions. And everyone has a role to play.
I think the last one that you said, everyone has a role to play, I couldn't agree more. Alnoor, you've obviously worked a lot in India and in Europe and the region. Your thoughts on how we could, what should we think of as we look at embracing this whole world of borderless health?
We need to build the whole ecosystem from a customer perspective. If the customer owns the data, and I think maybe something you were, and the customer then has a kind of in his pocket and gives it out, I think that's the only solution to this. I think it's doable, and we don't have to depend on people sharing if we give it to the customer.
If I go to you, Satish, your thoughts as you look at borderless health and the future of work.
If you really want to get to 2047 and to be very productive, the simple answer is we're going to have to keep everyone around us well, emotionally, physically, and financially, right? The answers are probably in thousands, but if we customize healthcare delivery to these cohorts, and if not for each individual, right? We haven't yet got to the point where every citizen gets a personalized plan, but at least even the cohorts that we have, or tens of thousands of cohorts. Historically, as employers, we came back and said, give us more incentives, we will solve problems. But maybe it's sort of time to go back and look at how do we remove disincentives, right? So if we pay for employee insurance, can we at least get an input tax credit, right? Can we pay for employer healthcare expenditure? Can we at least not have to charge a perquisite tax to the employee and then make that complex? Could we take an additional CSR spend on treating people, within the communities, that we operate in, right? And probably even the hospitals can play a role. where maybe they can get incentivized for preventive healthcare, right? Not just the reactive, healthcare under treatments today, right? See, finally, we're a nation that knows how to collaborate and solve problems at massive scales, right? Maybe we should just simply be Indians and solve an Indian problem, as much as we have, examples from the world. Maybe that's how we will have our 5G or the UPI moment, in healthcare. So that's sort of my views on what potentially can be done.
Just want to thank you, Satish, Hervé, Vibha, and Alur. Thank you very much for sharing your insights and your experience.
Raksha Summit 2024, powered by Medi Assist and BCG.